So here's something very important that you need to know when you're going to see a psychiatrist for a diagnosis of a mental illness. Out of 10 patients that a psychiatrist sees in a day or two or a week, 6 of them are probably going to get the diagnosis right. 4 are likely to go home with the wrong diagnosis. And these are findings from existing research. You can look it up. And so what that means is, to reduce the risk of getting an inaccurate diagnosis or an incorrect diagnosis, you really want to take time to sort through the symptoms. You really want to be thorough at evaluating the presentation of the symptoms that the patient is coming with. I'm bringing this conversation because a lot of requests now are patients asking to be diagnosed with a specific mental illness. So they want to be diagnosed with ADHD, they want to be diagnosed with depression. And so they're not looking to find out what is wrong with them. They've already Googled, there's no problem with Googling. And they've taken Google's word and they want the doctor to rubber stamp it. That poses the risk, meaning you're likely to become one of the 4 patients that are going to go home with the wrong diagnosis. And one of the biggest contributing factors is that we have an overlap of symptoms in psychiatric illnesses. An overlap means there's a symptom in depression that is also there in ADHD, that is also there in bipolar, that is also there in anxiety, that is also there in borderline, in personality disorders. And so, for example, if you're struggling with paying attention, if you're having the symptom of inattention, of lack of concentration, and you think it's ADHD, but then inattention can be there in ADHD, yes. It can also be there in depression. It can be there in anxiety. It can be there in bipolar. And so looking at one symptom and then associating it with an illness puts you at risk of getting a wrong diagnosis, which means that you need time to understand what other associated symptoms are present in that particular time, to lead you to the right diagnosis, to narrow you down to a specific, accurate diagnosis. That takes time, and you have to be very thorough. And you have to look at the psychiatrist factors and the patient factors. Because you might have a good psychiatrist, but the patient is not very good at expressing their symptoms. And remember, in psychiatry, we rely a lot, heavily, on patients' information or patient's expression of their clinical manifestations. And so if the patient is not very good at expressing what is happening, then however good the psychiatrist is, they might not be able to get the information they need to be able to make a good diagnosis. And other times, it depends on the psychiatrist factors. The psychiatrist is not good at what he or she does. And so even if the patient is very good at expressing their symptoms, the psychiatrist is not going to be able to make a good diagnosis because they're not very good at actually thoroughly evaluating the symptoms to distinguish the different diagnoses which have overlapping symptoms. And so understanding this then tells you you don't want to go into this lightly. You don't want to quickly get a diagnosis of ADHD and to be put on medication, because the medications that we prescribe to you in psychiatry carry serious side effects. Some of them carry light side effects, like for example, headache, but others do carry serious side effects, like heart issues. ADHD medication has been associated in very rare cases with stroke. ADHD medication can predispose you to depression. And so you don't want to go into this lightly. You really want to take your time to understand exactly what is going on, so that then you can get the accurate diagnosis. You can increase your chances of being out of the 6 that get an accurate diagnosis and go home with the right treatment. And even when you do go home with the right treatment, there's also the risk of treatment resistance or treatment failure, meaning yes, the diagnosis is accurate, but the treatment we're giving you is not able to provide a positive response or to provoke a positive response. And so then that poses a different challenge. So when you're coming to be diagnosed with an illness, I would say come with an open mind. Come to find out what is wrong with you. Come to understand what is wrong with you. And take it slow when it comes to starting medication, because there are alternatives before you can get on medication, especially if your condition is not very serious, because again, we have to assess severity. So there are people who have mild severity of an illness, of a mental illness, but they prefer taking medication instead of actually using milder forms of interventions. There are those who have moderate, and here you're looking at the impairment of function, or the degree at which your ability to work has been impaired, or your ability to function has been impaired, to see if medication is going to be better than starting non-pharmacological treatment. And so take your time to understand what is wrong with you. Take your time to understand your symptoms. Take your time to understand what is wrong with you. I'm repeating that. Before you get diagnosed. And sometimes you can get a diagnosis based on the information you've provided, and there's no problem with that. We call it an empirical diagnosis or provisional diagnosis. And then as you continue seeing your psychiatrist, as more information is being revealed, you realize that, oh, probably it's not depression, probably what we're dealing with is schizophrenia, and these were just negative symptoms of schizophrenia. And so your diagnosis could change. That is okay. But time is very important, and thoroughness is absolutely necessary. Careful assessment is absolutely necessary for psychiatric diagnosis.